Hello everybody, my name is Simon Marsh and welcome to 108 Harley Street. Here I am, sitting in one of our consulting rooms. There's our bright blue door in front of you, you can see where we are. And I think it would be safe to say that this has been a difficult year for everybody. And although we've been open normally and seeing our patients and doing our investigations and treatments as we always do, one thing I've missed is actually talking to people and talking about the things we do and how we can help and some of the problems we see. So that's why we thought we'd arrange this talk, this chat, to talk about things we do. And I'm very grateful to those of you who sent in some questions. And what I'm going to try and do is, by talking around a few topics, particularly in breast cancer and breast diseases, to answer as many questions as I can that you've sent in. Now, before I start, I would just like to do a little bit of background, and I think what you need to know is 108 Harley Street's been here since 1991. It was founded by Jerry Gilmore, who sadly died about a year ago, and what he did was set up 108 Harley Street in terms of teams, and what he realised is that the more people you have involved treating people, the better results you get. And he set up, as you can see along the bottom of that slide, there's a whole set of teams of people here now. Now, obviously, this time we're going to talk about the London Breast Clinic at the bottom left, but we've got teams of dermatologists who run the skin clinic, and also on the far right, we do local anaesthetic day surgery, so our dermatologists will be removing things as and when it's needed. I'm also involved in running the Gilmore Groin and Hernia Clinic, and I also work with the sports injury team, and we've got women's health clinic, vascular clinic that deals with varicose veins and so on, and bowel specialists, as well as our own x-ray department. So we can do all those things, and it was one of Jerry's great innovations, and there were many, all of which have been subsequently copied and followed by some other centres in London. It was this thing about teams that was really important. So what I'm going to talk about, I will give you a little introduction to the team that works within the breast diseases department on the breast clinic. I'm going to talk about some of the risk factors for breast cancer, particularly touching on things people are asking about, for example, alcohol and hormone replacement therapy. I'll talk about genes, genetic testing, family history and so on, and who can have genetic testing, particularly how much it will cost. And then we'll look at some of the treatments for breast cancer, again, particularly talking about some of the reconstructive options and how they work. And then we'll just finish up with some of the non-cancer, some of the benign breast problems that we see. And that should take us through, and I think that's probably enough one evening, but we should be able to cover quite a lot of things there. So, as I say, Jerry's interested in teams of people. So we have a team of breast surgeons working at 108 Harley Street, and that bloke in the middle seems familiar. Top left, as I look at the screen, you can see is Miss Fiona MacNeill. Bottom left, Mr. Jason Lee. Top right, Mr. Richard Sainsbury. Bottom right, Miss Tena Walters. So there's a team of 5 of us breast surgeons who all work together. But of course, you need more than just breast surgeons in the team. So we have a few x-ray specialists, a few radiologists. So we've got, again, top left, Mia Morgan. In the middle, Sarah McWilliams. On the right-hand side, Romney Pope. Bottom left, Steve Allen. Will Teh in the middle. And then Barbara Faissola, and bottom right, Charlotte Longman. And we all work together, and so we've got surgeons who see the patients, do the examination, the radiologists who will do the mammograms and scans, and we'll take any biopsies, and we'll talk a little bit more about how that all works as well. But even that's not enough in a team to treat breast diseases properly, so we have some plastic and reconstructive surgeons. So on the top left, Mark Gittos, bottom left, Stuart James, and then Kieran Power on the right. And these surgeons work with us in terms of rebuilding breast tissue. We've had to do mastectomies, they'll do reconstructors with us. And the important thing is we all work as a team. But believe it or not, even that's not enough. And we have all these other people who work with us. Now, in particular relevant tonight, top left is James MacKay, who's our genetic oncologist, and he's in charge of overseeing genetic testing, talking about what that means in terms of results and so on. We also have underneath James Dr. Clive Wells, who's one of our histopathologists. So these people are responsible for looking at biopsies under the microscope. And next to James, on his left, we look at, or the right as we look at it, Mary Falzon, another pathologist. Then we have a whole load of what are called oncologists who deal with the other forms of treatment for breast cancer. I'm going to talk a bit about those as well. So top right, Alison Jones in the red. Right in the right-hand corner, Nick Plowman. Underneath Nick, Catherine Pigott, and then going back the other way, Paul Ellis and Carmel Coulter. So you can see there are a lot of people involved with looking after somebody with a breast problem these days, and it all goes to mean that people who come and see us will get the best treatment, and that means you get the best results. And this was one of, say, Late Jerry Gilmore's real innovations, was bringing teams in to make sure people get the best results from their treatment.